Good morning, Board of Supervisors, CEO Carmel Angelo, County Council. I'm going to try and make this 3 minutes. I'm going to be speaking to you about COVID-19. This is a rapidly evolving, accelerating, complex pandemic. We have 0 cases in Mendocino County. I want you to know about me just for a moment. You may not know me. I'm a physician. I'm a family physician, board certified, hospitalist. I have a PhD in molecular biology, and I'm finishing up my master's in public health. So you actually have the right person in the job for being your health officer, and it's an honor to serve you. But I want you to know that I'm really a point person for the county for this COVID-19 outbreak. And while we have no cases, it's coming. Santa Clara has 43 cases. They had their first death from community spread. They just had a mandated health officer ordered ban of any gatherings greater than 1,000. Because this situation is so rapidly evolving, when I speak to you now, it's going to be different this afternoon probably because news keeps coming forward. I just want you to know we are on this in the Public Health Department. I mean, we're working 24/7. I'm up at 6 in the morning. Until 11 at night, I'm working on it. I'm up in the night taking calls, and I'm so grateful that we have the EOC. I'm so grateful that we declared an emergency, and I want you to know we're listening to all of the feedback that we're getting and responding as quickly as we can. One of the things that happened last week is there was an announcement right after I did my press conference, and I said there was no commercial testing available. Commercial testing then became available. So we thought that our healthcare partners were going to do more testing, but it turns out that test is not available widely. For example, the Adventist Health System does not have access to that commercial test at that time. I learned that yesterday. So public health is here to try and help to get the testing out to those who need it. There still remains strict criteria about who can be tested. And so when people come to me and I hear about cases, please keep in mind that there's a testing capacity limitation that we're dealing with. Currently, our testing through the Public Health Department is done in the Santa Rosa lab, Public Health Lab. That's the closest lab. And we have to courier those samples to that lab. Those samples have to be collected by our healthcare partners using proper protection. So it's very complex. 3 top issues for me at this time. One is testing. We want to make testing more available to those who qualify for testing. The other is mass gatherings. We need to consider if Sonoma County declares a ban on mass gatherings, whether we might do that. We don't have that in this place now. We're definitely discouraging mass gatherings from a press release we gave out yesterday, but they are not being banned as they have been in Santa Clara. So I want to follow Sonoma County on that. We also need to be thinking about surge capacity, helping support our hospital and help support alternative sites in case we have people that maybe don't have a home that they can go to be in isolation. So testing, mass gatherings, and surge are my 3 top priorities of these next days. And I want to give a shout out to one of the people that's been at my side day and night, and that's Jen Banks and Coastal EMS. They have been absolutely fantastic partners, and I rely on them heavily. So I'm just very grateful. In particular, I want to mention Jen Banks today. We're up in the middle of the night frequently together when we get calls through Redcom from our partners. I'm available to answer questions to you at any time, and I'm here to serve. Thank you.
Well, thank you very much, and thank you to